We're very excited to have Dr. Kira Mossop to talk about disaster response and recovery timelines, cycles, and common experiences in behavioral health. We're very grateful so many of you could join and looking forward to a lot of really helpful information. First, a little bit about the Northwest MHTTC and our entire network. So the MHTTC network is a nationwide uh, SAMHSA sponsored training and technical assistance center that spans across the nation. And our purpose includes disseminating and implementing evidence-based practices for mental health issues into the workforce. And our goals of the entire network include supporting mental health related practices, heightening the awareness, knowledge, and skills of the workforce, fostering alliances, and then providing and connecting you all to free training. Now a little bit about our specific Northwest MHTTC. So my name is Christina Clayton. I'm one of the co-directors, and we're responsible and humbled to serve the Region 10, which includes Alaska, Idaho, Washington, and Oregon. And our specific area of focus includes evidence-based practices for serious mental health issues. But we do a lot of other trainings as well. And so to find out more, you can go to our website. We'll tell you more ways to connect with us at the end. But probably you heard about us through one of our newsletters or someone forwarded it on. We are all remote doing this training, but it is very important that we acknowledge the lands where we all live and work, and that we acknowledge that the Northwest MHTTC, which is cited and sponsored through the University of Washington, is based in Seattle. And we sit on the traditional land of the Duwamish and Coast Salish peoples, past and present. So we're very grateful and always want to be respectful of that history and current reality. Also, a bit about language. We're always mindful that we want to use language that is affirming and promotes recovery. And so just as we discuss things today, we want to just have that perspective. So less labels and more person first language. Now, a few logistics about the session. So we've made every attempt to make this presentation secure. We have not had a problem, knock on whatever my desk is made of, but if it suddenly has to be ended unexpectedly, we will follow up immediately. Due to the large audience, you are muted and you're not appearing on video. Of course, it's a webinar, hard to do that with 87 people, but we will have time for getting your input. The presentation is being recorded, and we will have the recording and the slides made available within a few weeks, and we'll notify you when that's ready. And so never fear, we will get that to you. Also ask you to just be mindful if you ask a question. Obviously, we're going to moderate those in the Q&A section, but not disclosing things about a specific person or client or situation in your life. And as far as certificates, we will be issuing certificates. You'll get a separate email within a couple of weeks about that. There's no formal CEUs, but they're usually good enough to sort of submit to get hours, hopefully for whatever license you might have. Lastly, your feedback is really crucial to our work, so we would really appreciate it. We will give you a link later on in the presentation that just takes you to a very short survey, and that helps us. It's required by SAMHSA, so they know we did something with the money that we do, but we really appreciate your feedback, and we actually look at this all the time, and it's confidential. It helps keep the free training coming. It also helps the trainer know, how did this work today? Is there something you want to see differently? What did you most appreciate? So we take it very seriously and hope it's, just really a couple minutes of your time. So just to be clear how this best works is if you have any questions at any time, please put those into the Q&A box. I will be sort of monitoring those, and I don't want to take away from Dr. Mossop's presentation, but if something comes to you and you think, oh, I want to not forget that, just type it into the Q&A box and we'll get to that at that section. If you put them in the chat, we can't copy and paste. I don't know why. We can't copy and paste it. So if you put a question into the chat that's related to her content, we will ask that you put it in the Q&A section. Otherwise, chat is here. Our team is here to help if you have any technical issues. And yeah, please let us know if you're having any trouble. This is just a disclaimer slide. Not going to read it. Just means SAMHSA, of course, did not review Dr. Mossop's every word, and but they support what we're doing. Moving on. Now the important part. I'm very, very happy and pleased to introduce Dr. Mossop. She is a practicing clinical psychologist, her work revolves around resilience, trauma, disaster, behavioral health. I had no idea this such a fascinating topic that she covers, and I imagine you're going to be as blown away as I was when I first heard her speak about these things. So, teacher, presenter, consultant, all those things, and so I'll now humbly turn it over to our presenter.
Good morning, everybody. Thank you so much for having me. Thank you for the introduction, Christina. I will go ahead and share my screen and get all set up for that. Just give me one moment. Okay, just want to make sure I can see the things that I need to see. One sec. Okay. I really appreciate having the opportunity to present to you all today. Doing disaster relief and response work is something that I've been involved in for the last 11 years. My first initial foray into direct response was after the earthquake occurred in Haiti in 2010. I'd been learning about it academically prior to that, but there are a lot of disasters. We know a lot about how human beings respond and recover to them. And part of my great interest in this work is that it facilitates the opportunity to get to see human beings in difficult circumstances, but doing their best and being very resilient, and the incredible opportunities and empowerment that can come from managing difficult circumstances for folks is something that is very rewarding to me. And I look forward to sharing some of the information about these processes with you as well. So thank you for having me. I'm going to be sharing with you today general response and recovery trends. I'm going to be sharing a general chart that represents the pattern with which humans respond to disasters and what the recovery and response cycle tends to look like, regardless of the type of disaster that we experience. We just happen to be in one right now, and I'll explain the context of COVID and how that overlays with this chart as I go. But we're going to start with that. And then I'm going to give you more information about understanding what happens in each phase. Like, what are the common experiences that people go through, typically how they respond, what are the kind of red flags and things to be aware of at each phase. And then the last section of the presentation is really about just kind of understanding what we can do about it, and how to address the common responses in a way that really keeps in mind a sort of a holistic behavioral health approach, and normalizes for many of us what we might be seeing and experiencing these days. Okay, so I'll start with this. This is the timeline that represents that pattern of behavioral health response that most of us have to disasters. This chart itself is based on a SAMHSA graph from aggregated data for at least the last several decades worth of disaster research. It represents the general pattern, like I mentioned, regardless of the type of disaster. We have studied, obviously, the earthquake in Haiti, Hurricane Katrina, 9/11, the tsunami in Southeast Asia, and a variety of other small and large scale critical incidents and disasters all over the United States and in the world. So this pattern is very well supported based on all of those bits of research and anecdotal data as well that's been collected over the last several years. This chart specifically has been adapted and applied to the experience in Washington state in COVID. COVID is classified as a natural disaster, so that's probably a good place to start. Any pandemic or epidemic or even an outbreak can potentially be classified as a disaster. A disaster generally is just something that disrupts the regular functioning of a community, a pocket of people, or in the case of a pandemic, an entire state, nation, or world. So this chart is overlaid with the COVID experience of the pandemic and for Washington state in terms of the timeline. So the impact phase was approximately mid-March of 2020. And that's when the initial experience was felt by most of us, where our work situations were changed or closed, people had to stay home. There were guidelines and requirements about where you could and couldn't go, and wearing masks and hand washing and all of those things that sort of disrupted our day-to-day functioning and made it different. So that's the impact phase. And I'm going to say more about each of these phases in just a second. We proceeded very quickly from impact up into the heroic and the honeymoon phase. It feels like a lifetime ago now, but it was actually in Washington about late April or early May for 2020. And then we go into what's called the disillusionment phase. And that is where we are now. The disillusionment phase typically occurs around 6 to 9 months post-impact from any disaster. There always is a disillusionment phase, regardless of the type of disaster, but the nature of how it plays out definitely varies. With COVID, obviously, it's not an earthquake. There wasn't infrastructure damage per se, and you don't see rubble lying around on the streets. So the emotional and behavioral health difficulties that folks experience in the disillusionment phase are different in a pandemic than they would be if it was an earthquake and there was more visible physical damage that folks were seeing. Unfortunately, for Washington and certainly some of the northern latitude states, depending on when the impact phase occurred, the disillusionment phase also happened at the same time as a variety of other things, just coincidentally, which feels very appropriate for 2020. It feels like all of these things were layered together. So we had daylight savings time, we had the fall weather change, we had the election, socio-political turmoil associated with that, and then we were heading into the holidays with a second huge spike of cases, which really set people back. And we were, I think, many of us looking forward to spending more time with family and loved ones during the holidays, and we're unable to do so as a result of that. So the disillusionment phase is particularly challenging in the context of COVID, even though that's generally the hardest part of the disaster response and recovery cycle anyway. We are really dealing with a unique set of circumstances that all came together at once. The dotted line on this chart represents something that's called a disaster cascade. Disaster cascades are common. A classic example really is what happened in Haiti in 2010. They had the earthquake in January. They had a cholera epidemic that occurred in the spring of that same year. They had a hurricane in September, and they had very significant violence related to an election in November, all in 2010. Every time there is another impact, it restarts this cycle that's represented on this chart. So a disaster cascade sets back the recovery timeline, and it also raises the acuity of the symptoms that people experience. With COVID and in Washington state and in Region 10 generally, what we're keeping an eye out here for in the disaster cascade are generally other impacts, socioeconomic impacts, maybe educational impacts, and then other impacts that families have experienced individually. Certainly in the state of Texas right now, they have experienced a clear disaster cascade with what's gone on with the storm and the heat and power and water situation there. So that's another very clear example. The reason why it's a dotted line on this chart is because it's something that we're sort of keeping an eye out for and monitoring right now. I can't say, unequivocally that everyone has experienced a disaster cascade because it can vary on an individual and a community level. One of the other really important takeaways from this chart is that I want you to notice that eventually we will get back to our baseline that we started the pandemic with. So whatever the skills and the resilience and sort of the baseline level of behavioral health functioning was that you had coming into this disaster, the vast majority of folks will get back to that level of baseline. Typically, it's around 18 to 20 months. With COVID, we're seeing that, it's still that 18 to 20 month window isn't completely unrealistic, but it's likely to take a little bit longer just because of the nature of this type of disaster. So I want one of the takeaways from this chart to be that I think realistically, most people's experience on an individual level in terms of behavioral health symptoms in COVID is going to be somewhere between the solid yellow line and the dotted line moving into 2021, the where we're headed now. Having the vaccine rollout and the weather, the hours of daylight that are increasing and the weather starting to improve, all of those things have a really significant positive impact on people's behavioral health. Our symptoms will start to decrease a little bit. We'll be able to get outside and spend a little bit more time with friends and family and loved ones. All of those things make folks feel better. So we're getting there. We will get there. And that's kind of one of the most important takeaways of this whole presentation is that resilience continues to be one of the most common human outcomes from any type of disaster all over the world. And that is definitely the case with COVID as well. Doesn't mean we won't have our ups and downs before we get there. Okay, other takeaways from the forecast. Washington state has 7.6 or so million people-ish. And we are currently seeing numbers in the range of 3 to 4 million in terms of individual folks, including teenagers who are indicating that they are experiencing clinically significant symptoms of depression or anxiety. With COVID, unlike other disasters, depression and anxiety tend to be the primary experiences that folks have. I'll say more about that in a second. PTSD is not the common response to this disaster. And when I say clinically significant, I'm guessing most of you understand what that means, but the fact that these numbers are so high indicates that people's ability to function is being compromised, and that's the ability to take care of themselves, take care of their family members or their kids, or be able to work and to participate in getting things done at work. So um, it's a big challenge in terms of the proportion of the population that is being affected, and it's something that we can all, in our awareness of, reach out, check in with each other, and sort of recognize the extent to which this affects most communities at large. Another thing that's very common with any disaster is substance use, and substance use generally increases. We've seen a variety of really interesting trends in Washington, and in fact all over the country, about alcohol sales and various other issues related to substances as coping mechanisms for folks. One of the biggest concerns that we are, aware of right now is rates of binge drinking, which have increased nationally for women between 30 and 60 years old. That is consistent with some demographic data about how women tend to be affected by disaster recovery, which I'll say more about in a minute. But I'm very concerned about just keeping an eye on what the long-term effects might be of some of these substance use considerations in terms of people's behavior. Okay. Another thing that we're seeing very consistently is this thing called pandemic apathy. And pandemic apathy, I guess, to summarize bluntly, is basically we're over it. We are so tired of this thing. We don't want to be in a pandemic anymore. Nobody, we're over COVID and we're done. We know that behaviorally there tends to be patterns of expression for how people deal with the difficulties that they're going through. People tend to express distress externally by acting out, or they tend to express distress internally by acting in. So acting in and acting out is a normal part of the disaster response and recovery pattern. Right now, both acting in and acting out are being seen through this lens of pandemic apathy. So acting out in this context is basically like, the pandemic is over for me. I'm just going to pretend it doesn't exist. I'm just going to go about my business. I'm not going to comply with guidelines. And acting in is about, it's the opposite of that. It's kind of giving up on things getting back to normal, and feeling like you don't want to participate, and you kind of are isolating, and you don't want to do much of anything, and you don't think it's ever going to be okay again. And it looks a lot like symptoms of hopelessness, maybe major depressive disorder. People's personalities tend to draw them towards one of those two poles of acting out or acting in. I'm not saying that people squarely are in a category or in a group like that, but there tends to be patterns associated with either acting out or acting in. And that's something that we've been monitoring throughout the summer and all of 2020. I guess I want to leave off on this slide by mentioning that an eventual return to baseline is anticipated in the late spring, early summer months of 2021. Most people will be feeling significantly better by then. It doesn't mean that the pandemic necessarily will be over. I don't think we can put it behind us so cleanly like that, but people will have adjusted. We will have psychologically taken the steps that we've needed to get to more of a place of acceptance around what we've lost and what we've been through and what we've gained. And most folks are going to be feeling significantly better at that point. Okay, a little bit of info about the specific phases of disaster. One of the interesting things about this, if you kind of pay attention, the social media and the memes and the jokes really reflect where we are in each one of these phases. It's a really interesting sort of phenomenon. The impact phase is the first thing. So for Washington State, again, that was mid-March 2020. That's usually within a couple days. It's like when life gets disrupted. For an earthquake, it's very clear to pinpoint, the exact day and time when that happened. For COVID, it's certainly more tricky. Other states all over the country experience the impact phase at different points. So the whole nation is not necessarily on the same timeline that we are here in Washington. But typically the impact phase is about 0 to 48 hours. It's a range of time. The emphasis is on survival. What do we need to get by? And then what are the next things that we're going to have to do? We kind of go into shock. It's like, what is happening? I don't know if any of you were driving around, if you had work or if you were out on the road, but there were almost no cars on I-5. And it was a very, very eerie experience. I was doing some work for the Department of Health at that time, and that's why I was traveling. And I've never seen the freeway basically empty at 4 o'clock on a Friday afternoon in the Puget Sound. That just doesn't happen. So it was a very eerie kind of experience. And for most folks, there's this initial burst of adrenaline and the shock that we go into where it's fight or flight. What am I going to do, and how do I panic? in social media and in memes, you're seeing things like one of my favorites said something like, "What are we going to do? Are we going to have to hunt for food? I don't even know where Doritos live." So it's funny, right? Somebody's taking a joke about it, but they're reflecting this idea that people tend to panic and go into survival mode, which is normal. The next phase is the rescue phase, and that can be anywhere between immediate, depending on what kind of disaster it is, to a week or so after the initial impact. The goal is to figure out how are we going to adjust to this? How are we going to get food? How are we going to get medicine? What do we still need? Is anybody remembering the hoarding toilet paper situation? That was all in the rescue phase. It's when hope and optimism are at war and at conflict with fear and uncertainty. So you have groups of people saying, "We got this, we'll be fine." And you have other people really panicking and very distressed and maybe not even able to get out of bed in some cases. That is when coronavirus was all over the news all the time. When we do disaster response work, we call it the Anderson Cooper phase of disaster recovery because it's when it's nonstop media coverage of whatever the situation is, which always ebbs and flows, right? So the rescue phase is very media heavy, lots of public attention, and this war between hope and optimism with fear. Um, Another example from memes and from social media sort of humor, somebody posted during this phase, my neighbor's house got TP'd last night and now it's worth $12 million on Zillow because of the toilet paper thing. So just a little reflection of how people are feeling. The honeymoon phase is the next thing that we go through, and it's called that because that's when people are generally feeling the best. It can be about a week or so post impact. Let me see. I got to move some stuff around on my screen. It's when people are feeling the most cohesive. So there's a lot of bonding. This is the Seattle strong, Washington strong. We've got this. We're in it together. There's a lot of discussion and a lot of public sort of public discussion around the resources that we can bring to bear and a sense of relief. Like, okay, this isn't going to last forever. It's a temporary thing. We will get through this together, and it really does feel a lot better for most folks. Sometimes there's a sense of denial about how serious the situation is and how long it will last. I participated in a few meetings around this time, and I was hearing comments like, well, the pandemic will be over by summer. And I was thinking to myself, that's not true. But I can understand where the thinking was coming from. And then sort of the surprise and the shock that occurs when, in fact, it doesn't end and it's not over. So, um, other reflections about the honeymoon phase from social media in terms of people using humor as a means of coping. One of them said, "It is now recommended that masks are worn inside the house at all times, not to prevent COVID, but to prevent eating constantly." And that's a more humorous take on that whole experience for sure. Okay, just a reminder of where we are in this. So we covered impact, heroic, and the honeymoon phases. And now I'm going to talk about the last two, which are disillusionment, where we are now, and reconstruction and recovery. Disillusionment, again, typically occurs between 6 to 9 months post impact. For Washington State, the disillusionment phase started around September or October of 2020 when kids were supposed to be going back to school and weren't. And there was a lot of shock and a lot of disappointment about, wait a minute, this isn't going to get back to normal for a while. The disillusionment phase is typically characterized by this coming to terms with what's been lost and what is not going to get reset for quite some time, and working through the emotional processes associated with that. Okay. Um, this is more information about the disillusionment phase. So typically 6 to 9 months. It's definitely longer, and because of what I was jokingly calling the trauma lasagna that happened in November and October, the election and the daylight savings and the hours of darkness and the weather and the holidays, blah blah blah, all of those things piled up on us for the disillusionment phase. And one of the consequences of that was that it really did stretch out of it a little bit longer than we would normally see. The disillusionment phase is also the highest risk for substance use, suicidal thinking and behavior, and just acuity of symptoms in general, especially around anxiety and depression for sure. So it's when the shine is off in terms of media attention and coverage. People are so tired of hearing about coronavirus, this and that. And it tends to be also around the time when assistance runs out, when temporary money and temporary relief of emergency funds is no longer available, or it's gone. It's when depression is typically at its highest. And please do keep in mind that we are in that right now. Um, The demographic group that we are most concerned about in the context of disillusionment right now are youth and young adults. They are really struggling with regard to this. I think in part because of the specifics of how the pandemic has affected their lives with isolation and just like the developmental milestones that they're not getting to experience. But that's speculation at this point. I think that that demographic is uniquely poised to be experiencing some challenges right now for sure. And then not to be doom and gloom, the way we're headed is towards the reconstruction and recovery phase. So as I mentioned earlier, that's heading into late spring, early summer when most people start to feel a lot better. It may continue on for years, depending on the type of disaster. COVID isn't the kind of thing that just goes away. There's a lot of there are a lot of nuances in how we relate to each other, how our businesses function, how we have fun, like how we recreate. Are there going to be concerts? What does that look like? What is the nature of professional sports and people getting together and cheering for their team? How does that look, and what kind of map do we have to lay out for ourselves, and how can we empower ourselves to create one when we don't have it because nobody's experienced something like this before? So there can be a sense of empowerment associated with opportunity in the reconstruction and recovery phase. And that is something as a clinician that I really want to emphasize. If you do have the opportunity to work with clients or patients, really to emphasize that that opportunity for empowerment that is on the horizon for all of us, for sure. Okay, the population exposure model basically talks about um, mapping the extent to which people are likely to be more at risk for first incident disorders, behavioral health disorders, based on their experience in the disaster. So, to break that down, the folks that are closest to the epicenter of the bullseye are the ones most likely to have more severe symptoms or be affected by the development of a new incident of disorder in the long run. And that can be, major depressive disorder, generalized anxiety, PTSD, et cetera. Those are the folks who have personally been hospitalized or been on a ventilator with COVID or who have lost a loved one. We just crossed a really grim milestone in our country with 500,000 deaths from this disease. And that's a lot of families and a lot of individual people who have been affected by this thing. So that's that center. The next ring out are folks who have been exposed, um, but not seriously injured themselves. So maybe they have had some really sick family members. Maybe their lives have been really significantly impacted, but they personally, they didn't lose anyone that was directly close to them or something like that, and so on and so forth. People who are contact tracing and who are first responders and who are medical professionals and healthcare providers, those folks are all in one of those first initial A, B, C, or even D rings. So they're closer to the epicenter than the vast majority of people in the general public. Everybody in the country is at least in group E, and arguably in the world, depending on how COVID has affected places where people live. So that's people who can identify with the surviving group. The nature of a pandemic is such that, like I mentioned, at some point, everybody has been affected by this, even if that's just the fact that you're not working in an office anymore and you're working at home, for example. That's still in effect. Okay. Other takeaways from how folks respond to disaster. Children are especially vulnerable. They tend to be under-identified, under-reported, and under-treated. We tend to think kids are resilient, they'll bounce back, which is true, except, right, they also need to have specific support around how to navigate the upheaval that they've experienced in their lives. There's a lot of information that we have about the fact that when children are exposed to traumatic events or disasters, they tend to regress a little bit in their development. Very, very common and not necessarily something to worry about. But when parents don't have that information, they think something's wrong with their child. They might become even more anxious because they don't understand what the behaviors are that they're seeing. So children are in this very precarious position, basically, of being ignored or assumed to be fine and resilient, or needing extra support, in fact, and potentially not getting that support. I don't need to read the slide to you, but some other important takeaways from this. We're seeing sort of a bimodal demographic issue. The young adults and the youth are really having some emotional challenges in terms of depression and anxiety right now, as are the older adults. So people who have maybe physical limitations and aren't able to move around as freely, or are very isolated and don't don't have connections or don't have very many surviving family members that are around to support them. So there tends to be a disproportionate sort of pattern in terms of outcomes demographically for how folks are affected. Women are more disproportionately affected than men. And I was mentioning earlier, the binge drinking rates for women between 30 and 60 have increased nationally. That is not something that we're likely to see the long-term effects of for a couple of years in terms of health issues that may arise. But it's something that is happening now that is going to have a trickle-down effect in the long run. Um, Being married and being a parent are risk factors, and COVID is a prime example of how those two things can potentially additionally affect women by having to work from home potentially and navigate the multiple challenges of managing online school to the extent that they do, and working from home or the household in general. There seems to be a direct effect related to that as well. And then another really significant and important takeaway from our experience with COVID is that folks of lower socioeconomic status and folks in the BIPOC community are clearly significantly more affected from a behavioral health perspective, both in terms of symptoms and in terms of risk of death and severe course of illness. There is lots of data to support that the disproportionate experience of the pandemic is exacerbated um, across communities that traditionally, at least, have fewer access to resources. So that is something not only that we just need to be mindful of, but that we need to actively respond to and prepare for, and try and do something about in terms of intervention, for sure. Typical shorter term impacts. So these are data points that have been collected again from a variety of disasters. So many people experience acute stress disorder symptoms after a disaster, up to 33%. PTSD is not typically the response. 9/11 was a big exception to that because of the nature of it. So in Manhattan and in New York, for example, rates of PTSD were around the 50% mark, which again, not super common. For natural disasters, it's usually going to be anxiety and depression. For COVID, we are seeing PTSD for folks who have been hospitalized, ventilated, and had maybe a long haul COVID experience. That's a different scenario. Fortunately, that's not the most common scenario across the population. So most folks in the communities nationally are experiencing symptoms of depression and anxiety rather than PTSD. Major depressive disorder typically occurs in 17 to 45% of people post-disaster in general. As I mentioned earlier, Washington State is between that 3 to 4 million mark in terms of people who are already acknowledging that level of symptom. So I'm hopeful, and I think realistically hopeful, that by the time we get to late spring and early summer, most folks are going to be feeling better there. But these are concerning numbers, because in terms of professional resources that are available, we may not have those things, that level of service that we need. And then again, the disproportionate impact on BIPOC communities and communities that have lower socioeconomic status in terms of access to behavioral health care is another big concern. So lots of depression and anxiety symptoms and less PTSD is one of the takeaways. Another thing that happens with every disaster are something called MUPS. It's an acronym for medically unexplained physical symptoms. And what that means is that, because one way to say it, every disaster clinic I've ever worked in has run out of Tylenol and Pepcid AC within the first 48 hours. We always have to restock because every person is coming through the door with a headache or a stomach ache. And that makes sense. When you have your body constantly dealing with floods of adrenaline and you go through shock experiences, or you have cortisol that's building up, cortisol, that stress hormone that builds up over time, it makes sense why people would be having physiological responses. It is very normal to have these experiences post-disaster. And I think part of the reason why I'm sharing this information is so that we can continue to normalize it and let people know that it doesn't necessarily mean there's something bigger that's wrong with them, which is generally a concern that folks have. So for disasters, you have 30 to 80% of people reporting MUPS at some point in 2020, right, and through the summer months. And then 10 to 40% continue to have ongoing, headaches and stomach aches, maybe general fatigue. Sleeping is such a big problem for folks right now. that is going to be more of a chronic condition, and it's a known chronic condition for disasters that we have been aware of for some time. So important for medical providers and primary care folks to keep in mind. Okay, this is one of my favorite slides because it really helps normalize what's going on a neurological level for people in any disaster. The limbic system is that section in the middle there, and that's the part of the brain, obviously, that's responsible for emotional processing. So for the last 10 or 11, going on 12 months now, our limbic systems have been constantly scanning for threats, constantly trying to identify where the next threat or hit is going to come from, and then trying to activate to keep us safe. One of the consequences of that is that our brains are exhausted and they are not functioning in an integrated or effective way right now. When the limbic system is so active for such a long period of time, what that looks like is that people are really having trouble with emotion regulation. So you might wake up in the morning thinking, this is going to be the best day I've ever had. And then an hour into it, you think it's the worst day you've ever had, and back and forth all day. And it's not even a Monday. Another consequence of the limbic system sort of experiencing what it is that um, most of us are not as able to accurately interpret information that's coming in. So the human brain right now is more likely to perceive neutral information, whether that's a stranger on the road or a colleague at work sending you an email. Our brains are more likely to perceive neutral information as being negative, threatening, or hostile, just naturally, because our limbic systems are so tuned into that. And another consequence of the limbic system being so active is that the prefrontal cortex is not. And that's the part of the brain that handles all the executive functioning, right? All of the planning, organizing, the stuff we need at work. That part of the brain is not integrated very well when we're in this long-term survival mode. And how that looks is that I would say um, a great number. I don't know how much of a majority it is or not, but a vast number of folks that I speak with regularly would indicate that they feel like as an adult that they have symptoms of ADHD or early onset dementia. They're very concerned about it because they feel like something is really wrong with their brains. I cannot stress how normal that is right now. It is it's constantly reflected by walking into another room and not knowing why you just went in there, forgetting half your grocery list. I saw something the other day that said, be careful if they scan your head for your temperature at the grocery store. It may cause memory lapses. I went in for milk and bread and veggies and came out with nothing but chocolate, right? So that's alluding to a couple other things that are common experiences right now, but just the memory issues that people are having. It also means you can't track details. You're not able to focus as well. You can't stay organized in your own head. You can't, did I send that email? Did I not? And it's distressing. It's very worrisome for folks. Very normal at 11 months into this disaster response cycle that we are part of. Other things, so I mentioned the cognitive and the emotional. The behavioral is represented with the substance use and the acting in and acting out. Headaches and stomach aches, trouble sleeping. It's usually either not being able to turn your brain off at night or waking up at 3 o'clock in the morning, your brain is on again and your body is still really tired. So really advocating for people to try to write down, keep a pad of paper by the side of the bed and write down the things that wake you up or sort of things that your brain is like jogging a memory around, and just write it down as that's happening so that you take the pressure off of the prefrontal cortex to hold that information. Even if you can't read it, it's better to use a pad of paper and a pen at night rather than to turn on your phone and stimulate your brain with the light from the phone. Another thing is the snacking. So jokes about snacking and eating, stress eating, have been rampant right throughout this whole thing. It's a really big issue, and it's something that most folks are struggling with. And stress eating happens for a reason, right? When we eat carbs, we get a little bit of serotonin, a little bit down the road, chemically. So that hit of serotonin, that neurotransmitter that makes us feel comfortable about things, is triggered a little bit in part by carbohydrates. So it makes sense. Normally, it's something that occurs with seasonal affective disorder and around the holidays at these latitudes anyway. But for many folks in Washington state, at least, we've been seeing patterns like this all year, for sure. Okay. The good news is that the typical long-term response to disaster is resilience. And that's what I really want to emphasize. In terms of the common outcomes and the common responses that most people have, resilience is right there in the mix. It's something that we can develop. It's something that we can teach kids, adults of all ages. And it's not rocket science. This is just working on developing these ingredients in a way that works for you. So it's not trying to add more work to anybody's plate. It's about thinking differently about where you are in this disaster. So resilience is made up of four things, and I'll talk more about them all in just a minute, but it's connection, purpose, adaptability and flexibility, and hope. Those are the ingredients. And here's how it breaks down. So purpose is that first one, and it really is about making sure that your goals and your motivations, what gets you out of bed in the morning, is the right size. In a disaster context, because there are so many unknowns, it's really hard to set and achieve a goal for 3 months out, 6 months out, or a year down the road. As much as we all want to plan that nice vacation that we need, that might be a little bit, um, it might be a little bit too soon to do that. I would really encourage people to narrow it down and rein in the sense of purpose. Like, think about what motivates you, what you need to get done, what you can achieve on a short term basis. Um, in a perfect example of hashtag COVID brain, what I don't even remember what day it is right now. So it's Wednesday. Okay, I had to look at my calendar. Today's Wednesday. I would encourage people to think about what happens Thursday or Friday and what you need to achieve, and something fun that's a small scale thing that you can plan for the weekend. If you keep the scope small, the chances are that you'll be able to achieve it and really reinforce that sense of purpose goes up exponentially. Think about what you get back from your work, what motivates you and what drives you, and attend to that because your limbic system is not doing that naturally right now. So paying attention to the positive reinforcers that you get from the things that you're involved in. The connection is another thing that's taken a big hit with COVID, just because of social and physical distancing that's been necessary. But connection is anything that prevents us from being isolated. And again, excuse me, it can be small or large scale. So a relationship with God or a higher power, or with pets, or with loved ones or family members, or connection to other people with a social cause or social justice issue that you feel passionately about. That's a great way to connect with folks. We have to be creative about that. And that is hard neurologically right now. That creative part of the brain is not, it's more offline. So it takes more effort. But connection is essential to resilience. And it can be anything. Um, I use the metaphor of a tree when I teach this internationally, and the purpose is the fruit of the tree, and the connection are the roots of the tree. Oak trees have huge networks of roots that spread out over a vast distance, and they're all kinds of different big huge roots. And a palm tree, for example, has like a more singular tap root that goes way down deep. That's a really good example of how connection can be completely different for individuals, but still just as effective. So it's what works for you. And then flexibility and adaptability is that strength that the tree has, if continuing the metaphor, to adjust in the storm, to sway in the storm and in the wind. If, like a tree, a human is rigid and will not adjust and adapt to the changing circumstances, we will too also crack and break. And flexibility and adaptability, excuse me, is the hardest one. As a clinician, I believe that that's the one that most people struggle with the most because change is just difficult for people in general. It's about being adaptive with your space, with your time, your schedule at work, with your priorities, with the way that you have fun, the things you choose to do on the weekends. It's necessary in all aspects. Doesn't mean it's not challenging. It is, but it's not impossible. It's something that we can all try to do more of. And then the last one there is hope. Hope is not the same thing as optimism. Hope is realism that's grounded in a sense of opportunity and challenge. And what I mean by that is that our brains are so tuned into threats right now. We're used to perceiving things as threatening. And hope is about taking that input and adjusting our thinking around that input from being a threat to being a challenge. It's about realistically reevaluating a scenario and saying, okay, what are the opportunities? What are the ways that I can shift my thinking from threat to challenge that can be overcome? That gives you hope, right? On a much more literal level, hope is something that's gone up significantly with the vaccine rollout that's coming on. And it also just tends to increase as the weather improves and people can get out and experience sort of more normal. But yeah, hope is a little bit harder to pin down. It's different for everybody as well. Okay, this is the last model for today. This is an acronym that I developed to sort of really summarize things that are helpful in disaster response and recovery that don't add more work, that help address all of the common responses that people have. So the first one is to model resilience. If we each focused on purpose, connection, and adaptability for ourselves, that social influence that we have of doing something and having other people copy it is very, very meaningful. Um, People do what they are shown, they don't do what they're told. So modeling is incredibly influential and helpful. Engaging with active listening, listening to other people, to your family members and your friends, with the intention of understanding their experience, not fixing anything. We don't do that naturally. We try to listen to fix, and that's not helpful in a disaster because you can't do it. The issues people have with COVID are so big and meaningful, right? If you listen to try and problem solve, you're not going to get very far. So engaging in active listening allows you to increase connection, which is part of resilience, and also allow the person to process what they've gone through. Develop healthy boundaries. Time off needs to be protected, it needs to be valued, and it needs to be completely separate from work engagement. And then the next one is to just identify things that make you feel better. I'm not a huge fan of the term self-care. I think it's been overused and a little misunderstood. But what I mean by that is putting a list on your fridge that is stuff that you know makes you feel better when you're having a bad day. Maybe it's baking cookies, maybe it's taking a walk, maybe it's a hot or cold shower, maybe it's listening to a podcast, maybe it's watching a show, maybe it's doing something nice for a neighbor. Anything and everything, small scale, large scale, that you know makes you feel better. When you have a bad day, you just pick something off the list. You are not going to want to make a list when you're having a bad day. So getting that list in place ahead of time is a good plan. And then the last thing is to change expectations. We all owe it to ourselves and to our children right now to adjust our expectations about what success and performance and winning means. It is not the same, and it cannot fundamentally be the same in a disaster setting than in a non-disaster setting. So we have to shift our thinking. We have to think about effort, and adjust the sense of outcomes. It doesn't mean let go of expectations. It means adjust them and change them. There are several resources. The slides will be made available to everyone, so I don't need to spend any time on this, but we have a wonderful toolbox for families, a resilience guide. Everything can be found on our main behavioral health resources page. If you're curious about trainings, please don't hesitate to reach out to this admin email, and we will get back in touch with you about that. So I'm going to try to take some questions and answers, I think, briefly.
Right. Yes.
See how
Thank
it goes. Yeah.
you. Thank you so much. There are some questions, so I want to get to those, but I did want to let folks know that this is actually the first of a whole series of content that Dr. Mausath, I know I was going to say it wrong, is doing for us. So I want to put that in the chat. So we have that there. I'm not sure if one of our team can look at the slide deck that you sent and get those resources put in our chat as well, but we will definitely post all the resources from her slides in our product page when we notify you. So if you can't get those quickly right now, we apologize, but we will definitely get those to you. So that is the event page where you can see there's another webinar on March 11th, and then there's 4 types of skill modules that she'll be doing small group kind of training. So if you want to know more, please take a look at that. I also know of something that you have been involved with, and I didn't even really know that when I first started getting these, which is the Behavioral Health Impact Report. And so if you're in Washington and you haven't seen these reports, I just wanted to put a link to that because it's fascinating information. And then I'm like, oh my gosh, you're at the bottom. And, seeing these trends and knowing all these things, it's just really helpful. So may or may not apply if you're not from Washington, but I think the stuff is pretty universally informational and helpful, and just reiterates like what you're saying, because who hasn't gone into the R room and not remembered why they went there? What day is it? Who knows anymore? So the first question we have in our Q&A is, I work with adolescents. Most are finding connection through video games. I have some kids like that. Is this healthy or detrimental for them?
I would say anything in moderation is perfectly okay, especially if it's being monitored. One of the bigger concerns that we have right now is unsupervised online time for kids, teens, and adolescents. Connection is valuable no matter what. So I would say as long as it can be monitored safely and it's not 8 hours a day every day, then video games are perfectly fine. It just needs to be monitored in terms of safety. But yeah, kids need to get connection any old way they can. So I don't think that's out of hand a bad idea.
Yeah. And I think for any of us whose kids are doing school online, don't mean to sound disparaging there, but it's really difficult. So it's like your fun time is on screens, your school time is on screens. And, so I know that's a balance we're all facing too. All right, another question. How can behavioral health employers support employees through these phases, especially to
Mhm.
support resilience? What are some practices or policy you've seen employers adapt to support their resilience? A great question.
Yeah, great question. Thank you. So, really briefly, I would refer you also. We have a document that's on our resources page that breaks down resilience techniques for organization level, team level, and individual level in the workplace. So I would start with that. But one thing that I would say is just really that need for flexibility and increasing and opening those lines of communication between the employees and yourself or whoever is in those supervisory or leadership roles to work out what people's individual experiences are in this disaster, because some folks are doing okay and others are really not doing okay. And meeting people where they are, having those individual conversations to make accommodations to the extent that that's possible, and really focusing on that flexibility and adaptability piece. That's going to be something essential for resilience. And then also building in connection. One of the things that's missing in the workplace is that water cooler chit chat. If we were meeting live, people would recognize each other and, hey, how are you doing? How are the kids? We don't get to do that anymore virtually. So building in a non-agenda rotating host open Zoom lunch. I know it's more screen time, but the only rule is that you can't talk about business. You just chit chat with each other and connect. And that's a really helpful thing for people to do in the workplace to sort of increase that general social connection. Yeah.
Well, thank you. Another question. I'm dealing with children, ages 8 to 15, taken from parents home due to neglect and sexual abuse. Do you have specific activities to suggest?
Yeah. For children who have been experiencing multiple layers of trauma that are very specific like that, what you really want to focus on is routine and safety, so that they have a specific routine that they're following every day and that they feel comfortable, they feel physically safe and comfortable. And a routine is one of the most effective ways to establish that and practice that for kids. When they know what's coming, it automatically makes them less anxious about things. So that's bedtimes, meal times, playtimes, etc. And keeping in an uncertain world, keeping things as structured for kids as possible is very, very helpful with regard to that.
Great, thank you.
Yeah.
I'm going to go to the second to last one. What do you recommend for addressing people with poor or no access to the internet for telehealth
Yeah.
interventions? I know some of you've been dealing with it, the state for
Yeah.
the entire time.
Yeah, the healthcare authority has been doing all kinds of work on this specifically to increase access for underserved communities. That's not something that I personally know a whole lot about or am directly involved in. We have been advocating for making sure that materials and resources are made available to communities in paper form and as wide a variety of um, implementation as possible. So not just online for people who don't have access, but in pamphlets or audio podcasts or other means, and the Washington Listens line, like just a phone call that somebody can make. So we've been trying to address that very actively from the beginning of this response.
And I'm not sure, you may
Yeah,
have said this, where on the graph, and this is back to your slide, so I apologize, we don't have those to show. Where on the graph would
okay.
the incident that occurred on Capitol Hill, did it bring us further down? So of all the things that have been facing us,
Yeah.
yeah.
Yeah, that's a great question. It didn't. It definitely was an event that directly affected folks within a smaller community. So I don't want to say across the board that it wasn't another an incident or an impact phase for a smaller group of folks. But what we did see on a statewide level was something that we are recording and reporting in our sit reps, which are
Mm.
weekly reports that our team is putting out, our group, behavioral health group. And we saw in Twitter people responding with a sense of cohesion, but also significant anxiety and significant loneliness. And we saw big dips with what kinds of conversations people were having around the time that George Floyd was murdered, and with other like sort of socio-political events that have taken place nationally. So there have been there have been blips, but in terms of the overall disaster response and recovery cycle, that particular thing and what happened on Capitol Hill didn't reset or didn't restart the cycle on a statewide or a larger level.
Yeah. So I guess that's, I don't know if that's good news. If the stuff is so
Yeah.
high, it takes a lot, right, to get something else happening. So,
Yeah.
well, I want to thank you so much. I want to just go through a couple more things as we wrap up here, but I'm really, really thankful for your time. Your feedback is really important. And if you enjoyed this, we'd love to hear from you. It honestly takes just a couple minutes. I am not just saying that. I do them myself when I go to things. It's just a quick couple of clicks. And if you enjoyed it, I'm sure Dr. Mosseth would also appreciate hearing, how did you like it? What was missing? What did you
Yes.
especially like? We as presenters and training folks really value your information. Let's get to the right click. Here we go. If you haven't connected with us via our website, if you're not getting our newsletter or you do social media, there's lots of ways to connect with us. So please let us know. You'll hear about these things when they're announced. And so that way you won't miss an event. And I didn't say this in the beginning, but when you go to our website, you can also see at the top, I'll have to make a different slide for this, but you can see all events for all across the nation. There are, 10 regional centers, 2 specialty centers, and anyone can usually attend any event. So it just depends on if there's a very specific, kind of thing. But generally, you can attend lots of things. Many things are recorded like ours. So, and thank you for joining us. Let's see, some just other stuff, comments in the questions. Otherwise, I think we're doing pretty good. And otherwise, thank you so much for joining us. And thank you, Dr. Mosseth, really just such timely and helpful information. So thank you so much, everyone, for being here. Oh, yes, thank you. And the recording slides, we'll get all the resources, the links, we'll notify you by email, and also look for a separate email about the certificate if you desire that. So, all right. Thanks, everyone. Thanks, Dr. Mosseth.